Welcome to ESG Decoded, where we navigate the evolving landscape of environmental, social, and governance, ESG. Join me, Amanda Kuhl, Erica Schiller, and Anna Stablem as we explore the intersection of sustainability, innovation, and ethical leadership, the dynamic forces shaping our global economy. Welcome to ESG Decoded. I'm Amanda Kuhl, your co-host for today. And I'm really excited to be talking with Jason Fischer from Houston Methodist. Now, this podcast, what we try to explore is where sustainability and business innovations intersect, where it comes together. So what I'm excited to learn about from Jason is about this Green ICU Initiative. Houston Methodist is one of the first in the U.S., and I want to learn more about what does that mean? What are they doing? And just learn also more about Jason's fascinating story. Jason Fischer is the Assistant Director of Sustainability at Houston Methodist. He leads the Office of Sustainability, which aggregates the sustainability efforts for the organization while strategically aligning current and future projects through innovation and conservation to meet the organization's goals of corporate sustainability in support of health and well-being. Jason, welcome to the podcast.
Thank you. Thank you so much, Amanda. I'm glad to be here.
Me too. I'm so glad you had some time to talk with me. So I'm in Houston, Texas, and I'm familiar with the amazing work that Houston Methodist does and the lives it saves for. So I learned from Spotify Rap that we're in 56 different countries. So for all our listeners around the world, Jason, will you tell them a little bit about the Houston Methodist Hospital system and also your role there?
Absolutely. Houston Methodist Hospital was established in 1919. Out of the necessity during the Spanish flu pandemic. It has continued to grow over years, and currently we have 32,000 employees. Our flagship hospital is located in the Texas Medical Center, which is the largest medical center in the world. And we currently have 7 community hospitals for Houston Methodists around the Houston region as well. The work that we have done over the years has grown considerably with the establishment of our research institute, which continues to grow and provide top-tier research in the Houston Medical Center, along with our cohort. And we are actually, with the U.S. News and World Report, an honor roll member in the top 20 for multiple years now, serving Houston and beyond, and proud to have that recognition and the work that we do across the world.
I know there's people that come from all over the world because Houston Methodist is such a leader in medicine and care. So, and I'm just lucky to have you in my hometown. But tell us a little bit more about, you have a unique journey into sustainability.
Yeah, absolutely. I started my career actually in organizational and leadership development and nonprofit assistant. And during that time, I actually got sick and had to have a stem cell transplant. And it was through that process that I became very intimately familiar with healthcare in my time and my treatment. That inspired me to want to get involved and change my career and to help serve an organization that helps others during their health event. And so in doing that, I joined the hospital where I had my transplants and actually worked in environmental services. And eventually I moved back to Houston, my hometown. In 2017, helped to launch our newest hospital in the Houston Methodist system, our Houston Methodist The Woodlands. And I led our environmental services team and patient transportation team at that location. And when I arrived on site, we looked to deploy recycling bins across our campus, but found out that the recycling wasn't going to any processor. It was most likely ending up in the landfill. And while we were doing a lot of cardboard recycling, we wanted to really expand and find some other opportunities. Unfortunately, we were met with the problem of China rejecting the world's recycling, and a lot of that recycling being warehoused in California or other locations where we're ending up in our landfills. So further compacting the problem. And so, talking with my manager on my team at that time, we looked at, what else could we do to provide an impact from a sustainability standpoint? What could we do, for the betterment of the environment if we couldn't, recycle at that time? And so
in 2020, we began looking to make an impact in another way and find some other avenues to make an positive environmental impact from the hospital. And so working with my manager, we started exploring opportunities and partners for composting at our facility. And we had a lot of barriers, but didn't let that deter us. We kept coming back. We'd put it on the shelf and come back and explore it again. And eventually we were heard, and our waste hauler came to us and said, we have this potential partner in Moonshot Composting. And this was in 2022, and Moonshot had established their operations in 2020. And so we started conversations to deploy the composting for our food services at the Houston Methodist, the Woodlands. And we launched in August of 2022 and saw great success. To date, the program has spread to 4 other campuses, and we've diverted over 300,000 pounds of food waste from the landfill. And so during that time, I was talking with my CEO, and she asked me to revisit plastics recycling and said, we need bins across this campus. What can we do? Let me know how I can support to make this happen. And so went back to the drawing board to explore some other opportunities for plastic recycling, and hit a lot of barriers again. I reached out to organizations that were exploring advanced recycling in Europe, and hit a lot of barriers again. And so rather than going back empty-handed, I said, okay, again, what can we do differently that makes an impact? And so I went to the drawing board and looked at everything across our operations at that location from a sustainability standpoint, and put together a sustainability plan for our campus and reviewed what we were doing well and where we had opportunities to improve. And so through that, in presenting that to my CEO, she said, this is perfect timing. Our system is looking at establishing a sustainability office. And so she was very gracious to connect me with Ed Jones, our CEO of our research institute. And working with Ed, we started to lay the groundwork for our Office of Sustainability, which we officially founded in January of 2023.
Oh my gosh, what an awesome story. What would you say to other people who are running into all these barriers? It just sounds like it takes persistence. And what else besides persistence does it take?
I think persistence, and I liken it to one of my mentors saying, it's a marathon. And so there are going to be sprints, and there's going to be, times where you're taking breathers. And so don't give up, keep moving forward. And I think persistence is really the biggest thing that I've seen, and I've heard across sustainability as well. When I talk to others, it's really about, a no now doesn't mean a no tomorrow. And so how do we come back to that, or put it on the shelf somewhere, but know that it's not gone, or it's not a wasted opportunity, but it's just the door isn't quite ready to open at that time.
So now the Office of Sustainability, it's I guess celebrating its 1 year, almost 2 year anniversary. Where does it go from here? What are the big kind of initiatives or pillars that you're working on?
Yeah, absolutely. The 3 largest objectives that we focused on for 2024 was really around establishing our emissions baseline and understanding our emissions, having a better understanding so we can plan for the future. Also, we've launched a medical PVC recycling program in partnership with Westlake Dimex, which we hope to make a viable medical PVC recycling program that other hospitals and other PVC recyclers are able to pick up, that's financially viable and sustainable for all organizations. And then last has been a focus on employee and community engagement. How do we get our employees involved to champion initiatives and come up with our own grassroots efforts and to support those? And also, how do we connect with our community organizations and other sustainability leaders to help drive direction and support within the Houston community and within the Houston hospital community? And as we look to continue growing, we are establishing our research arm of our sustainability office, looking to connect the dots between community health and adverse health events, and also the operations of healthcare, how it impacts community health, and looking at sustainability, healthcare economics, and how that impacts our services down the line, how it impacts our community, and being able to serve and create healthy communities.
I think that's really powerful. I think sometimes we think, I mean, I know this podcast is called like environmental social governance for but all the times we're trying to break down like these buckets because they're not silos. They're really interconnected. And I think that's really fascinating research that the organization's going into. I wanted to ask about the medical PVC pilot. So when I think of medical PVC, I think of a lot of gloves. Am I thinking of the right things?
There are some gloves that are
Okay.
vinyl. There's nitrile, vinyl, and there's one other.
Okay.
But there's
It's
actually
more than that.
it's more than that. Yeah,
Okay.
yeah. So there's when we look at the program that we're pursuing for medical PVC recycling, it's focused on three specific areas. It's our saline bags and our lactated ringer bags used for hydration of patients, and also our oxygen masks and oxygen cannulas, and also the oxygen tubing, all which is made from PVC.
Gotcha. Understood. And I think it's really interesting to think about the possibilities of this pilot because if it's successful, I mean, the Texas Medical Center is this huge campus made of, multiple hospitals and medical facilities, right? Like if you're able to, if that's, find a way forward, it benefits everyone in this, I'll call it a campus. I don't know. Or a district. I don't know. A campus is not the right word. It's a district.
Yeah, right. This is mini city. Yeah.
Yeah, it's its own mini city for sure.
Absolutely. We're hoping to build a blueprint that others can participate in. And I think this specific pilot is really helping to inform some other pilots we're working on with the Healthcare Plastic Recycling Council and Alliance to End Plastic Waste. And I think it's really imperative to understand your PVC and how it impacts your local recycling viability. And so I think this will help us to really be successful in future expansions in other areas of recycling.
And what would you say are some of the drivers behind this program? Obviously you're one of the drivers, I can tell, but besides, Jason's being the champion, what are some other reasons that, Houston Methodist wants to pursue this?
Yeah, absolutely. The big focus on health and well-being, we want to make sure that the work that we're doing isn't drumming up business downstream, that we're creating a healthy environment, not contributing to health outcomes or disparaging health outcomes in our communities. A lot of this is also driven by employees throughout our Houston Methodist hospital system. When we look at our physician group, when we announced our Office of Sustainability, our system CEO announced it in his president's letter, and we had the largest response from our physician groups to any president's letter in the past. And so there's such a huge support from our physicians. They understand, they see it, they know how it connects the dots to our health, sustainability and health. And so we see that across the board with our physicians, our employees and nurses who are on the front lines and discarding items and seeing the single-use materials and devices that we have. They are disheartened by what they see and wish they could do more. And so there's a big driver there. And then in our research institute, there's such a culture of sustainability and wanting to do more. We have such a great, diverse and international community. And we have individuals that come from all over the world, and there are locations across the US or other countries that are doing it better. And we want to step up and really participate and help lead and drive that change.
That's so cool. It's also wonderful to hear how well it was received among the physicians and employees as well. Something else I'm thinking about, and I think we spoke a little bit about this and when we were preparing for this, is one of the challenges in healthcare is in sustainability in healthcare is really where do you put your money, right? You're trying to advocate and improve community health. You're also trying to be more sustainable, also for community. But we all have a limited budget every year. How do you any advice of how do you navigate this balance? Any advice for others who are trying to navigate, how do we balance between multiple really good causes and the impacts we're trying to make?
Right. Absolutely. You really have to look at the organization. What is your mission and how is your organization driven? And when we look at Houston Methodist, we want to lead medicine. We want to provide unparalleled safety, quality, service, and innovation. And in doing those things, we need to evaluate how our sustainability efforts may impact that. And so, for example, we have a population there's a long wait to get an MRI. And so when we're presented with, we can spend $1 million on a solar program, or we can spend $1 million buying a new MRI machine, how do we best spend that money? How do we make that decision? And a lot of that comes to making sure that we're serving that patient population the best we can. When we look at our Green ICU movement that is led by Dr. Faisal Masood and establishing practices to reduce waste and be more efficient, and to also look at resiliency from an employee and also patients post-care, there's a lot of focus on that safety aspect. We want to do better and be more sustainable, but we're not willing to sacrifice that quality and safety for our patients. We need to find a way to balance the two.
Yeah, it's hard with like so many important like competing priorities of finding that balance. It's hard. One other thing I wanted to ask you about was, you mentioned that there was a second pilot going on. I wanted to ask you a little bit more about that.
Yeah.
What's that?
Yeah. So with the Alliance to End Plastic Waste and Healthcare Plastic Recycling Council, it's been a really great partnership. We were approached by the Alliance and the Healthcare Plastic Recycling Council to look at pursuing a hospital recycling program about a year ago. And so we've been really fortunate to have the expertise of manufacturers and recyclers and polymer experts. And we've really been exploring trying to build a blueprint for our hospital, but also for other hospitals in the Houston area. And so we're focusing in specifically on plastics, but also looking at other areas that we can increase our recycling throughput. And so with that, we're currently in process and about to launch at one of our locations. We're looking at 3 different locations to trial something a little bit different depending on our haulers and sortation methods. And so it's been really impactful and insightful to drill into the information. And I feel like every month we're learning something new, but also developing a pathway forward that we can develop, not just for Houston Methodist, because it's really going to be an effort by all of our community hospitals and our hospital cohorts throughout the area. And there's some exciting technologies, and we're learning some cool things that we're hoping to share with others as we continue to grow to really show the viability and possibilities around the recycling programs.
I feel like there needs to be a big bottle of champagne. Thinking about where you talked about, you started your journey, we started trying to find ways to reduce, waste to landfill through different avenues. Like when these are like pilots are all successul and done, I feel like there's going to be a giant bottle of champagne needs to be popped.
I'll be there. I'm ready. Yeah.
Well, Jason, thank you so much for coming on the podcast today. It's been so interesting to learn about what you all are doing, this Green ICU Initiative. So thank you so much.
Yeah, my pleasure. Thank you, Amanda.
Whether you're a seasoned ESG practitioner or embarking on your sustainability journey, ESG Decoded is your trusted source for inspiration and actionable insights for responsible business practices. New episodes drop bi-weekly on Tuesday mornings. Make sure to subscribe on your favorite streaming platforms to be notified, and connect with us at ESG Decoded on social media or by visiting climbco.com.